Eu gostaria de falar para os nossos espectadores que o vídeo da doutora Estela será também traduzido, legendado para o português logo mais. Então, eu passo a palavra à doutora Erica. Dr. Erica, please.
We don't hear.
Sorry, I was muted. Would you like me to share my screen, or will you be swapping it? Yeah, great, thank you. And can I forward the slides from there? Let me just try. I'll go back and forth. No, I can't forward those slides. So shall I share the screen?
Hi, Dr. Erica. You can just press Alt and Tab and come back to your presentation, that it's already on the presentation mode.
Okay, thank you. Okay, is that working?
Press again, please.
It's on my screen.
Yes, but it didn't change the slide. Maybe you should share screen again.
Okay. So it says stop sharing. So I'll stop sharing for a minute and then I'll start sharing again.
Yes, please.
Okay. So I'll come out of this one. Sorry for the delay for you guys. And I'll start sharing again. So share screen. Is that working for you now?
Yes, it's working.
Great.
Thank you.
Okay. Thank you. So I'm Erica Mallery Blythe. I'm going to be speaking about the child vulnerability to health effects of non-ionizing radiation. And I'm going to do this in conjunction with a paper that's recently been released from a group I've collaborated with, International Commission on Biological Effects of Electromagnetic Fields. I'm a special expert for that group and the founding director of Physicians' Health Initiative for Radiation and Environment, or FIRE Medical. So this is the paper that we recently released, and this will be spoken about in more detail by Ron Melnick. So I'm just going to focus on one assumption here, which is that there are no differences in absorption of RF EMF or susceptibility to this radiation for children. This assumption underlying the current guidelines is incorrect, and I'm going to share a bit of information about why that is. To do that, it's really useful to look back in time for a moment. So the same group who have set many current guidelines, the ICNIRP, in 2002 admitted that there are variations in tolerance and highlighted children, the elderly, and chronically ill as all potentially more susceptible, and questioned whether they might therefore need separate guidelines to safely accommodate that group. I think they certainly do, either that or a singular guideline which really safely, genuinely takes all of these groups into account. But why did they abandon this really important concept? When you look at their fact sheet here in 2020, they admit that exposure values from adults have been used to set the restrictions for children. Now, their reasoning behind this is because they say they're basing all of their health data on one parameter, essentially. That is core body temperature. So children have an excellent ability to thermoregulate, and what they have said is that because children's core temperature doesn't increase more than adults, that means they are safe from all potential health effects, which is a gross oversimplification of the truth. And in the ICBE paper under Assumption 7, you'll see references for all of these figures demonstrating that we would expect potentially 5-fold the radiation absorption in the eyes of a child, about double potentially in the brain, 10-fold in the bone marrow of the skull, and up to 30-fold potentially in certain substructures within the brain like the hippocampus. This was illustrated some years before that by this important graphic from Omgandi looking at the modeling of absorption into the brain of a child when compared with that of an adult. And you can see how much more deeply the radiation would penetrate that brain. So it's not simply about core body temperature. That would be a very insensitive measure of health in relation to these kind of radiation exposures. And we really have to take into account non-thermal effects that can happen at orders of magnitude below that heating level. Looking at the unique anatomy of children, as we've just done in those slides, but also the tissue dielectrics of children. For example, neonates have on average a higher water content in their brain. This could make their brain a more efficient microwave absorber. Unique physiology of children, they have developing systems which behave in many ways very differently to the more completed systems of an adult, particularly the neurological system, their reproductive systems, etc. They even have different types of cells in their bodies. I'll move on to that with my next slides. But before I do, I have to mention latency, which is, of course, a serious issue for children. Previous generations may only have been exposed in later life, whereas this current generation are exposed literally from conception. Now, when we think of something like carcinogenesis, which can have decades between the exposure and the manifestation of cancer, that becomes especially important in this group because they may be young adults or in the prime of their life at the point when those kinds of carcinogenic effects could manifest, overall increasing their risk. And this is just to remind that there are so many differences in their physiology. This is just one of them. Numerous studies have showed stem cells to be particularly sensitive to this kind of radiation. And here you can see the vast difference in the large number of stem cells present in a newborn when compared with an adult. So these are just a few of the disease endpoints, which I think are especially important when we're considering children. These first few are relating especially to the central nervous system, where we see a lot of these effects concentrated, are all rising in childhood populations. And there's credible literature which makes connection with these kinds of exposures, particularly strong evidence when we look at reproductive damage, particularly male reproductive harm. There are many papers now looking at damage to sperm, but also potentially structure and function of the testis. Also, some papers demonstrating concerns with oocytes, and little girls are born with all the egg cells they'll ever have. So this is especially important. They can't make new ones. And if those eggs are damaged at any point before reproduction, not only could that have an effect on their fertility, but also potentially cause damage that may manifest in their offspring. Leukemia was previously the leading cause of cancer death in children. And this is the literature here is more focused on effects linking with extremely low frequency ELF, but we must remember that the current communications frequencies in the radio frequency range are pulse modulated at ELF. And importantly, the next on the slide, brain tumors, this has been very much linked with radio frequency communication apparatus, and particularly glioblastoma multiforme and acoustic neuroma. There's some evidence that these are rising more in the younger populations, and the concerns raised by the human epidemiological data have really been corroborated from prestigious groups like the National Toxicology Program and the Ramazzini Institute when you look at the large-scale animal studies demonstrating the same cell types of tumor in those groups. And we must mention briefly breast cancer. John West has published a case series of very young women who had breast cancers directly behind the antennae of the phones. These were very aggressive tumors, and he felt that there was very likely a causal link between carrying their phones in their bra and the breast cancer that was detected. Electromagnetic hypersensitivity is primarily hallmarked by symptoms focused in the central nervous system again, headaches, insomnia, tinnitus, cardiac palpitations, and links in with the early points on this slide as well. And when we keep seeing these neurological effects, It's important for us to have a look at how robust that is in the literature. And I'll mention this from Henry Lai, published under the umbrella of the Bioinitiative report, showing 244 out of 336 papers. Very high percentage here showing effect, not just in human groups, but also in animal groups. And this is really important, especially when we look at electromagnetic hypersensitivity, where sometimes it's claimed that these effects might be somehow psychological. Obviously, animals can't be reading newspapers and scaring themselves about the effects of Wi-Fi or cell phones. So this gives us some idea of the consistency of these neurological effects. And we also have valid mechanisms, so some level of coherence with laboratory findings. You can see here, this is focused on data from this ICBE publication that I cited at the beginning of my talk, 124 out of 131 studies. That's 95% showing effect in terms of oxidative stress from these kinds of exposures. So it's been really well validated as a mechanism. Some would say indisputable at this point. So when we look at the health of children, and let's take a common scenario where children are exposed to this kind of radiation in school. So let's think about use of Wi-Fi in school. When we're computing that, we need to think carefully about risk versus benefit. And I've mentioned just a drop in the ocean of some of the endpoints which we're concerned about here in terms of risk. And the International Agency for Research on Cancer has designated this as a group 2B carcinogen, possible human carcinogen. So even just taking that risk alone, we need a really seriously demonstrable benefit to outweigh that risk in this young, non-consenting, and I would now go on to say non-benefiting group, because actually Wi-Fi in schools isn't there for essential education to children. It's there for ease of access to staff generally. They can access the internet using hardwired connections and mitigate all of these risks. So it's a really black and white scenario. We should be protecting our children in school absolutely immediately. Now, some governments have put out some information, and I want to say a massive thank you now to Dr. Mikhailidou. You just heard those incredible resources put out by the Cyprus National Government and with support of the Austrian Medical Chambers. Just a brilliant and important step forward to educate parents, schools, governing bodies, policymakers. France, with their ban on Wi-Fi in kindergartens and restricting under 6, these kind of movements forward we need to be seeing rapidly in all countries, not just a few. This is just the NHS leaflet from the UK with the very humble warning here, which is in fine print, saying that children and people under 16 should really only be using mobile phones for essential purposes. But the problem with this is that they did not disseminate that really important information. It's been around for years, but they didn't provide this for children, their parents, or their teachers. And some schools are actually prescribing homework on smartphones. And of course, if we're going to caution against phones, we must absolutely be doing the same for tablets, which can have a comparable or even in some cases higher specific absorption rate than a tablet. So we need to see consistency about this advice. Now, it's sad and embarrassing that we often see health protection move more rapidly in courts of law than we do through health advisory or protection agencies. And that's certainly what we're seeing here. Multiple cases have now been won internationally, for example, demonstrating causality between mobile phones and brain tumors and allocating compensation there. And we are also seeing successful legal actions internationally on disability, showing electromagnetic hypersensitivity as a disability for multiple groups. This is one legal case in the UK where a child is found to be disabled by EHS and low EMF accommodations mandated for that child in school. So there is some movement forward, but it's not fast enough to protect health in a responsible way. And here are some of the points that we are asking for more generally in the summary of our paper with ICBE. We're looking for independent assessment of the effects and risks of RF with a thorough review, including recent evidence. Legitimate safety limits need to be devised. The public should be informed immediately and given information on how to reduce their personal exposures. We need to see an immediate moratorium on further RF emissions and prioritise protecting children. So how do we do that, protect our children? Well, we can remove using flight mode, replace using hardwired alternatives, and reduce using shielding techniques. It sounds so simple on this slide, but in reality, in the complex digital world that we now inhabit, this can be really challenging. But we need to start, and starting with children and focusing on children is an excellent place to begin. So thank you so much for listening, and muchas gracias to this fantastic Brazilian team for highlighting this really important and rapidly evolving issue. Thank you so much.
Hello, Dr. Erica.
Hi there. I've stopped sharing my screen, and I can see you guys again.
Okay.
Thank you, Dr. Erica, for this amazing presentation. Daniela, can you continue?
Yes, so thank you very much, Dr. Erica. I guess I'll pass the next word to